back to Inside Politics. Our guest today, Dr. Alex Jahangir, who's the chairman of the Metro Board of Health, talking about the recent fourth wave of the COVID-19 down here in the community. Dr. Jahangir, President Biden is requiring almost all federal workers to be vaccinated. Should Mayor Cooper be doing the same thing for Metro workers to set that example? Should other businesses do that as well?
You know, the mayor and I have not had that discussion. Again, I think the mayor's led by example what he did around masks, and I think different parts of Metro government probably have different needs for vaccination. So I don't really have an opinion per se yet on that, but I think there's certain sectors that probably would benefit from.
Within the next couple of months, it appears there will be a vaccination available for children under 12. That's again going to get back into the schools. How will Metro go about getting those shots into schools once they are approved and are ready to get going?
Well, you know, we've very effectively we've been working on vaccinations for kids for a long time, right? For kindergarten and 7th grade, you need mandatory vaccines. Even for going into school right now for 12 and over, we've had over 375 pop-up events. A lot of them have been affiliated with events that come around going back to school where you have book drives and so forth. I suspect we'll continue those. Our Lens Public Health Department team will continue to provide vaccines if needed. There's
been a significant amount of reluctance and opposition to the vaccines. We've been talking about some of that. Are we likely to see an even stronger pushback about vaccinating young children?
I mean, yes, I think there will be pushback, and I think this is the key. I want to be very clear. I'm not saying you need to mandate that kids get vaccinated. I do think that parents need to evaluate what that means for their kids and get the vaccine if they feel it's right. But I also do think that if you want to get back to school safely, if you want school to remain open, if you want to avoid potential long-term impacts of COVID that we don't know about, I believe vaccines are a safe way to do it. But again, I, as a parent of 3 kids, have made the decision for my kids when they're able to be vaccinated. But I don't believe anytime in the near future there's going to be any kind of mandate for kids to be vaccinated against COVID for school.
There hasn't been a lot of use of family doctors, or in this case, pediatricians, to get involved. We talked offset about the fact that it's hard for them to give them out, as they didn't have the cooling devices in order to keep the shots in their offices. But getting them not involved, particularly with these young children, if there's anything a parent pays attention to, it's what the pediatrician tells them. How are you going to get them involved when they're not still going to likely be given those shots?
Well, I think pediatricians have always been leaders in getting kids healthy lifestyles. Right? They ask about car seats. They ask about home situation, food. This is usually another thing the pediatrician advocates for, speaks about. And if the opportunity presents for us to get the actual vaccine to the pediatrician's office, I know public health will, but this vaccine issue is a lot greater than just public health. Medical centers all around the city have them who have affiliations with pediatricians. So there's a lot of ways to do it, and I completely agree with you. A person's personal doctor is a great resource to get medical advice.
One of the ways that people still say, no, I'm not going to get that shot, is because the FDA has given only emergency authorization for this. They've not given the permanent thing like that. What's holding it up? Millions upon millions of people have had these vaccines. They appear to be completely safe for the most, at least the side effects have not been any worse than anybody thought. In fact, in some ways, they've been even less than what they thought. Why not give that final approval? Is it just being held up by paperwork and red tape?
Well, again, you'd have to ask the FDA directly. But my understanding is hopefully by Labor Day, the FDA full authorization for the Pfizer vaccine will come out.
The nation's leading officials, and Dr. Faustin, we talked about him a little bit earlier, he and his family have been threatened during this pandemic. In fact, there's even people who've been arrested now who threatened the doctor they were going to kidnap him and his family and execute them. You've been pretty out front here in this county. Have you had issues? Have you been threatened?
You know, it's been really interesting for me. The issue of civility has been something that I've really had to. I learned a lot about now being in the public eye. The stuff on internet and social media, it's really easy to have
You've been
courage.
Verbally abused?
But there has been several instances here in town where people have come up to me, and there's been moments where I do have some concern.
You thought you might be physically abused at one point?
Well, I think there are times when, I think it's more than I can. There's been some moments when it's been very uncomfortable. But again, I think what is critical is for all of us to remember we're all trying to help move us all beyond this and have some, and people just need to have civility. I think that is what's starting to be lacking in our society right now.
God forbid we have another pandemic, but as sort of a last question, are there reasons to believe we're more prepared to handle the next pandemic, or are we not prepared at all? Are we actually in worse shape now to have another pandemic based on what we've seen happen in the last year and a half?
No, I think we're in great shape, or much better shape. But if we continue what we're doing, and so what I mean by that is, locally, we received $26 million from the federal government to prepare for COVID, but also we can use some of those resources to build our epidemiologic teams, build our outreach teams, build some of the community infrastructures you need to support those who need it most. The thing that would potentially lead us to not be as responsive is if we have the divisiveness continue.
Dr. Jahangir, thank you so much for being with us. Thank you for your service to the community. I know this has not been an easy time for you, but I think everybody in the community appreciates what you've been able to do.
Grateful for you.
And thank you for joining us on Inside Politics again this week. Hope you'll be back here again for a future show. If you can't get into politics in the meantime, go to the NewsChannel website. You'll find my Capitol News commentary there. There's new commentary posted every Friday afternoon. Enjoy the rest of your weekend, and we'll see you back here next time. Goodbye.